So this is the review of the 2024A paper. And the key objectives, as always, especially for those sitting in August or beyond, is that we look at questions in terms of whether they're repeats, whether they're new, or whether they're variations. And I've got a level of difficulty scale, which I call a traffic light. And what I do is I bucket them into three areas. So green, yellow, and red. So green is a repeat with a pass rate of more than 40% within the last 10 years. A yellow is a variation or repeat with a pass rate between 20 to 40% or more than 10 years ago. And then a red is a new question or repeat with a pass rate less than 20%. And then what we'll also do is we'll also go through the learning objectives as well. So the first question was, outline the anatomy of the arterial blood supply to the spinal cord. So this question here, brand new, and it somewhat is distantly related to a 2016 B6 question, which is discuss the determinants and control of spinal cord perfusion, where you could briefly talk about the arterial blood supply anatomy related to that. So doing that question there, you would have briefly covered some of the anatomy. And I think that question, if you go through it, had a component where you probably could talk about the anatomy for about, a couple of lines, but it certainly wasn't the main focus of that question here. And for this question here, the learning objectives was BTRT 1.15, outline the blood supply to the spinal cord and the regulation of spinal cord blood flow. So fairly instructive, this objective with regards to answering this question here. And question 2, compare and contrast the following oxygen delivery devices: standard basic nasoprongs versus high flow nasoprongs. So one of the compare and contrast questions, and again, compare and contrast questions are incredibly difficult. But I have classified this as yellow, and the reason for that is that it is a variation of the 2017 A2 question where there was a 39% pass rate. So that question there was compare and contrast oxygen delivery via nasal cannula, nasal prongs or specs, and simple face mask, Hudson or CRG mask, and Venturi mask. So the only difference here is that you would have been able to answer half the question, and then you would have to talk about high flow nasal prongs. But hopefully by answering the question, I think one of the really key things I want you guys to do is that when you do answer a question, always read around it so that you're able to encounter scenarios like this where they ask you part of the question in a new format and also a new component as well. Now, the learning objective is primary BTPO 1.41A, discuss oxygen therapy, including methods of delivery, indications and contraindications, physiological and pathophysiological effects. Question 3, explain why a pulse oximeter may give incorrect values in the following situations: poor peripheral perfusion, carbon monoxide poisoning. And this was the question that we were discussing earlier, where they were very instructive in terms of what they want you to talk about. So this is a variation. Pulse oximetry has been asked before in the past, but they were very specific here in terms of the clinical scenarios where they want you to apply that knowledge to in terms of explaining why it will give incorrect values. So this was, you could see there were a couple of questions like this, and I'll sort of show you as we go along. Now, I have classified this as yellow because it is a variation of the 2021 A11, 2019 A15, 2016 7. So lots of questions on pulse oximetry, and the variations that you'll see is explain how a pulse oximeter works. Do not discuss the potential sources of error. Okay, that one there, I think, is not the one that we want, but certainly the second one is explain the reasons why a pulse oximeter may give incorrect readings. And in other words, by doing those two questions, you would have had a good foundation in terms of how pulse oximetry works, and then also understand in terms of the scenarios where it would give incorrect readings. And hopefully from that, you would have been able to cover poor peripheral perfusion and carbon monoxide poisoning as one of the two, and then be able to sort of answer this question here. And the learning objective is primary BTSQ 1.6, describe the methods of measurement applicable to anesthesia, including clinical utility, complications, and sources of error, in particular oximetry. Question 4, outline the pharmacokinetic factors which influence the time taken for loss of consciousness with an inhalational induction of anesthesia. So this one's classified as green. We have done a very similar question, but for intravenous induction agents. And I think hopefully if you sort of attended the session just about 2 weeks before this exam, we went through in terms of the modeling for inhalational induction. So I hope this was useful for this question here and how you were able to answer that one. Now, this was a repeat. One of the few repeats from the last 10 years where they had an over 40% pass rate. So 2015 B5, where there was a 50% pass rate. And that question there was fairly similar. Didn't have the pharmacokinetic word, but essentially almost identical. So outline the factors which influence the time taken for loss of consciousness during an inhalational induction of anesthesia. Learning objective primary BTGS 1.24, describe the uptake, distribution, and elimination of inhalational anesthetic agents and the factors which influence induction and recovery from inhalational anesthesia, including the concepts of partition coefficients, concentration effect, second gas effect, and relationship between inhaled and alveolar concentration, and significance of the distribution of cardiac output and tissue partition coefficients on uptake and distribution of volatile agents. The third one's probably where the money is for this question here. I mean, and when I say the money is in, that's probably where I think that a lot of trainees would have been able to sort of answer 1 and 2, and the third one's probably a little bit harder to discuss. But we have, I have got videos on this with regards to time constants in tissues and how it's related to both the cardiac output, the tissue size, as well as the partition coefficient. So have a look at that if you haven't already, to give you an idea in terms of how to answer this question here. Question 5A and 5B, describe the structure and function of the GABA A receptor. Describe the interaction of midazolam and propofol with this receptor. Now, funnily enough, when I saw this question, I thought this was a repeat. But when I look back at all the questions that have been asked in the past, I couldn't find it. So I think this is one of the questions that has probably been asked as a Viva. And that's the other thing, is that now I have noticed that a lot of the Viva questions, they are sort of translating that into a short answer question. So this was probably a variation, and you could probably find this, but you had to go into a paper more than 10 years ago. So this was almost over 20 years ago, actually. 2003 B3 and 2001 A10 outline GABA's role as a neurotransmitter and indicate how its actions may be modified by pharmacological agents. So it might have been new for most of you, and that's a challenge, isn't it? That as time goes on, there's actually more and more papers out there, and I think the workload certainly increases in terms of the coverage which you need to do to cover all the short answer questions that have been asked in the past. But I'll summarize in the end in terms of what I think you can sort of do sort of moving forward to really sort of focus and make sure that you're able to sort of cover all the papers that are over sort of 10 years ago. And then the learning objective was BTGS 1.49, outlined the proposed mechanisms of anesthesia and the sites of action of anesthetic agents. Question 6, this is the one that we discussed at the start. Describe the factors which increase the risk of systemic toxicity with AMI local anesthetic agents. Now, this was a repeat or variation. So this was a repeat, but the difference was that this was a repeat from over 10 years ago. So another question that you had to go above and beyond the 10-year paper, which I think a lot of us have been told to do, but as time goes on, you can see that they're reaching further and further back for these repeat questions. So from 2011, A1, 35% passed, 2009, A2, 31%, 2000, B5, 37%. So very sort of consistent in terms of its pass rate. The learning objective primary BTRA 1.3 discussed the pharmacology of local anesthetic agents, including toxicity, including management. Question 7, now classify this as a red one. Outline the pharmacology of the following urotonic drugs: oxytocin, ergometrin, prostaglandin F2 alpha, otherwise known as carboprost, using the following headings: mechanism of action, route or routes of administration, potential adverse effects. Now, the reason I've classified this as new, even though that there have been questions in the past asked about urotonics, the difference is that this one specifically talks about pharmacology, so all encompassing. The ones in the past, I think, have always asked about adverse effects, but this one here specifically wanted you to talk about mechanism of action and routes of administration. So this was probably a fairly sort of new one. Although in saying that, you probably could have got some of it actually through some of the variations in the past. So 2018 B13, 2013 B14 list the drugs which affect uterine tone and outline the adverse effects of these agents. And 2009 B6 discussed the pharmacodynamics of drugs that affect uterine tone. So I think doing probably those questions there, you probably could have answered mechanism of action and potential adverse effects. But I think the new component here was the routes of administration and to explain why those drugs had certain routes of administration. And I think that's a pharmacokinetic effect, which is not required in those two questions, which is why I've classified it as a new one. The learning objective primary SSOB 1.1 describe the pharmacology of drugs which increase uterine tone. Question 8, describe the pharmacology of opioids injected into the spinal intrathecal space using both fentanyl and morphine to illustrate your answer. So this was a repeat within the last 10 years. And last asked in 2020 A9, 2009 A5, 2004 A4, 2001 B12. So the last one had a 75% pass rate. So hopefully if you were able to sort of go through that and had a sort of a good structure, you would have been able to answer the components that were required to pass this question. And the ones that were how it was asked were sort of fairly similar. Outline the effects of opioids injected into the spinal intrathecal space using both fentanyl and morphine to illustrate your answer. That was the most recent one. And the ones in the past have been outline the effect of an opioid injected into the spinal intrathecal space. The learning objective primary BTPM 1.18 describe the pharmacology of epidural or intrathecal opioids. So we're past halfway through. Question 9, A, B, and C. I always find these multi-component questions hard. I'll sort of go through in terms of how many we had for this paper here versus how many there have been in the past. So this one was outline the mechanism of action of unfractionated heparin, outline the reasons why the inter-individual response to unfractionated heparin can be quite variable, and C, outline the potential adverse effects of unfractionated heparin on platelets. This is classified as yellow because there have been asked questions in the past with regards to anticoagulants. And if you were able to cover some of those questions, you would have been able to, I think, answer a large component of this question here. So variation of 2017 A8 and 2004 A8, compare and contrast low molecular weight heparin and unfractionated heparin, briefly describe the side effects and complications of heparin therapy. So especially the second one. The second one with regard to the side effects and complications, you would have been able to answer in terms of the inter-individual variability, which is why heparin requires close monitoring, and as well as the adverse effects on platelets. And I think that doing probably the first question, compare and contrast low molecular weight heparin and unfractionated heparin, would have helped you to be able to answer the mechanism of action of unfractionated heparin. Again, you see the importance of doing papers that were sort of over sort of 10 years ago to ensure that you've got the adequate amount of coverage for this exam. So the learning objective primary BTPO 1.118 describe the pharmacology of heparin and low molecular weight heparins, including their side effects. Question 10A and 10B. So 10A is draw a pressure volume loop for the left ventricle in a normal adult. Outline the information that can be obtained from such a loop. So hopefully, when we went through the graphs and diagrams, we did go through this pressure volume loop. Hopefully this was helpful to you with regards to answering this question. And again, interestingly enough, this question is asked quite a lot in the Vivas, but I think it has been asked before in the past. So yes, it is a repeat, but more than 10 years ago, more than 20 years ago, in fact, 2002 B9, 67%. And I think you guys are getting a recurrent theme with regards to this, with questions coming from over 10 years ago. So the learning objective primary BTPO 1.45 discuss the factors that determine and control cardiac output and the implications for clinical practice, including pressure volume loop relationships in the heart. Question 11, explain the physiological processes that cause oliguria in response to hypovolemic shock. This is a repeat question. So most recently, 2016 B13, but less than 40% passed this question. So it had a 34% pass rate, 2009 B13, 64%, 2006 A14, 38%, and 2002 A6, 72%. Now, interestingly enough, you can see that had a very sort of high pass rates, and then all of a sudden 2016 had only a 34% pass rate. So the learning objective from this primary BTRT 1.3 describe the physiological consequences of shock, but this question here verbatim asked 4 times in the last sort of 20 odd years. Question 12, outline the physiological roles of calcium in the body. Another favorite one that gets asked in the Viva. And this was a new question, which is why it's red. And often the easiest questions like this can often be the hardest ones. So the learning objective that this came from was BTPO 1.72, describe the function, distribution, and physiological importance of sodium, chloride, potassium, magnesium, calcium, and phosphate ions. And you can see how challenging this is because you're going to have to write a 10-minute answer for this question here. And I can imagine that if you were to write a card on this objective here, and you had to write about sodium, chloride, potassium, magnesium, calcium, and phosphate ions, you'd probably just have a card on it, and you'd have to, from that card, try to fill in enough information to actually write for 10 minutes. So I can see why this question is difficult. And I think what was quite tricky about this exam was that as we sort of head further on, you can see that another red question. So we've sort of started off in terms of, hard question at the start, and then after that, a lot of intermediate ones, and we're sort of ending with a lot of red ones, which can be very, very, I think, challenging, especially when you think about the time components and the time pressure that's involved towards the end of the exam, and especially when you're getting tired as well. So question 13, outline the differences between the respiratory physiology of a neonate and adult using the following headings: control, mechanics, ventilation, gas exchange. Do not discuss the upper airway or intubation. Now, this was a repeat, and the repeat was probably a little more broad. So I think they've tried to make it a little bit more clear in terms of what they actually want you to discuss here. And the reason why they've made it a lot more clear in terms of what they want you to discuss is because of the low pass rates that they had. So another variation, but one that was over 10 years ago, 2013 C11 with a 5% pass rate, and 2013 A11 with 11% pass rate. So asked during that time when they had the integrated exam. So, and I think when I said C, I think I meant to put it might have been the one where they had this was the first combined paper. So I think that's why they had the C there. And 2013 was when you could either sit each of the subjects separately, or you could sit them as a combined one. So I think this was in the combined one as well as the separate one as well. And then the question that was asked then was compare and contrast lung function in the neonate with that in an adult. And the learning objective was primary SSPA 1.24, outline the physiology of the cardiovascular, respiratory, renal, and neurological systems in a neonate, the changes that occur with growth and development, and the implications of this for anesthetic care. You can see that with this objective here, especially for those sitting in August and beyond, I think you do want to have a card as well for cardiovascular and one for renal and neurological systems in the neonate as well. And obviously respiratory has been asked before, and I think the new possible questions could be, yeah, those other components there. And again, one of not really a compare and contrast, but it's another one where you have to go side by side with regards to comparing and looking at the difference between, you know, one versus another. So I always, again, as always, you know, if you sort of hear me talk, these questions are always very, very challenging. Question 14, describe the physiology of the neuromuscular junction. Do not discuss excitation, contraction, coupling. Looks simple, but a brand new question. And brand new question, but based completely verbatim from a learning objective, primary BTPO 1.35, describe the physiology of the neuromuscular junction. And that's straight from there. And then the last one, outline the mechanism which cause each of the following after the release of an arterial tourniquet, which has been in situ for 2 hours: hypotension, desaturation, hypercarbia. One of the applied questions that has appeared on this exam here, and it is a new one, and that the learning objective was primary BTO 1.37, discuss the effect of the following on ventilation, especially with regard to anesthesia, and BTPO 1.48, discuss the cardiovascular responses to surgery and trauma. And this would have been challenging because there's nothing sort of specific with regards to tourniquet and its effect on hypertension, desats, and hypercarbia. It would have to be one where you would have to sort of read around, especially with regards to the concepts of how it's related to anesthesia, surgery, and trauma. And I think that it's one of the physiological scenarios that you see quite commonly in your everyday anesthetic practice, and probably one that I think is discussed again a lot in the Viva. And what I've noticed again is that, you know, they've taken one of the Viva questions as an idea and have put it as a short answer question. So in summary of the 2024A paper, what have we got? We've got 2 green questions, 6 yellow questions, and 7 red questions versus 2 green, 5 yellows, and 8 reds in the last one, which was 2023B. In terms of topics, again, very, very similar to what they've been doing over the last couple of years, where there's been an even split. So physiology, 7 topics. So neuroanatomy, cardiovascular was 1.5, renal, fluids and electrolytes, respiratory 1.5, neuromuscular. And then pharmacology, there was 6 questions on inhalational, hypnotics, local anesthetics, obstetrics, opioids, and anticoagulants. And equipment, there were 2 questions on respiratory and cardiovascular. But this is very sort of consistent, especially with the change that has been seen over the last couple of years. I think there was a chair before this, and then now the new chair as well has sort of continued this on with regards to the topics and how they're set out. And the other thing that you need to know is that they've always ordered it in the past. So this year it was a physiology anatomy question at the start, and then 2 equipment, followed by pharmacology, followed by physiology. So I think in previous years it was pharmacology, equipment in the middle, and then physiology. But you can see how they've sort of grouped it together. And I think that's sort of a very nice way, instructive way in terms of as you sort of prepare for August and or beyond. When you do practice papers, at least you know that you can actually practice them in block in terms of, you know, full pharmacology, full physiology, bit of equipment, and perhaps some anatomy as well. Now, with the 6 new questions, so there was one variation from over 10 years ago with less than 20% pass rate. There were 3 new questions directly based on learning objectives, and there were 2 that were widely based on learning objectives. But you can see the importance with regards to the new questions of making sure that you go through all the learning objectives, which is an incredible amount of workload. And you know my thought process on this that I've commented in the past, where I think that the expectation, which has changed a lot from, when I set, and I think when many people have said, where you get advice from, where they just talk about going through the exam questions over the last sort of 10 years, I don't think you can do that anymore. Certainly, as one of the new things that I've seen the new chair has done is that they really want to make sure that you go through all the learning objectives, and it is a lot of learning objectives and a lot of work. So just be aware of this, and just be aware of setting yourself that goal of making sure you go through every single one. Now, there were 7 intermediate questions. So interestingly enough, there were only 4 within the last 10 years, and then 3 of them were over 10 years ago. And I think that is instructive of just the process of time. And I think it does increase the level of difficulty for, the trainees that continually sit on in the future, because not only are you seeing sort of an increased depth of knowledge, I think that there's also that breadth as well that that's the expectation for you to sort of cover. So it's not something I sort of take lightly in terms of saying that, the future definitely gets easier. I think the future definitely has its challenges with regards to the trainees that, you'll see as you sort of sit in the future, with regards to more and more papers coming out and more questions that you feel like you're obligated to have to go and run through. Now, what are my observations regarding the difficulty of this exam? So from the traffic light system, there were 7 red questions in 2024A. Now compare this to last sitting, there were 8 in 2023B, there were 6 in 2023A, and then 4 and 5 respectively in 2022. But you can see a certain trend in terms of what they sort of aim to set every sitting. They'll aim to set at least, I think now with the new chair, anywhere sort of between 6 to 8 new questions. With the multi-component questions, and this is what I was quite critical about in the last sitting, with that cognitive load of having a lot of multi-component questions. There were 4 in 2024A versus 9 in 2023B. So certainly cut down in terms of that, which I think is actually a good thing. And one of the other things is that they were actually a lot more instructive with the broad questions. I think there were at least 3 questions where they were very specific in terms of what they wanted you to discuss. So take that as a good thing. It is, I think, a positive where if there's a broad question, you're left with, Pandora's box in terms of what can be answered. Whereas if they're very specific in terms of what they want you to answer, and hopefully it's core stuff that they've listed. And from what I can see, it is sort of core stuff, mechanism of action, adverse effects. Hopefully it is something that actually helps you score marks. But in some ways, I think that the other flip of the coin is that if you do know knowledge that goes above and beyond those constraints, then you don't have that ability to sort of show off that knowledge. So I think that's the only downside to that. But other than that, I think for most of us, it's quite instructive having those specific ideas in terms of what the examiners are looking for. Now, the word count, which was another thing that I was very, very critical about, 306 in the 2024 A paper. So certainly a big drop, almost close to 20% drop from the 2023B. And it makes a difference, absolutely makes a difference, with the time pressure of the exam, having to read quite a wordy question. I think that having a word count around sort of that 300 area is probably where it should land. So it's good to sort of see that it's come back down to around that 300 word count. Because I think last year's paper was extremely a difficult one. not only in terms of the new questions that were there, but also the amount of content in terms of the questions being asked. So this was a positive towards where this exam is sort of hopefully heading towards to, and hopefully we'll find some consistency, especially when we see the August paper. Now, what did I think? So look, this was a hard exam, probably the most difficult one, the second most difficult one since 2022. Certainly not as difficult, I think, as the last sitting in 2023B. But yeah, it was challenging with 7 new questions. But I think that's the standard that you'll see from the new chair. And again, my observations are that basic science questions continue to be ordered. So this was anatomy, equipment, pharmacology, physiology. Previously was physiology, pharm, equipment, and then previously was pharmacology, equipment, physiology. Now, the other thing that often I get asked about is, should you go through the ICU papers? And I can tell you that there were no questions from the recent ICU papers. Okay, and I think that has certainly been a change in the past, where probably about a couple of years ago, you could find maybe 1 or 2 questions that were asked from the recent ICU papers. But this one here, none of the questions have appeared recently. The other thing that you need to know is that there were 4 questions from over 10 years ago, and only 4 questions from less than 10 years ago. So you can see how that spread is almost 50-50. So the take-home messages for those that are sitting in August and beyond, again, in order of importance, and it's interesting to see how this sort of changes every sort of 6 months as we sort of review the papers. But number 1 now is that you have to review the SAQ papers, not just from the last 10 years, but over 10 years ago. And it's incredible amount of work. But even then, you're going to cover over 600 short answer questions. And look, when I say 600, some of them are going to repeat. So it's going to be a little bit less than that. But even from those questions there, you're only going to get 50% coverage. And that is a massive change, because previously, you could cover the last 10 years worth of paper and you could probably get a 70% coverage. Now you're only going to get a 50% coverage. And if you look at the repeat questions from the last 10 year with a more than 40% pass rate, only represents 13%. In other words, if you've got questions that has been asked within the last 10 years that you see has a pass rate of over 40%, it represents a very low proportion of what is going to be repeated, or there's going to be some variation of it in your exam. And what I would do is, with those questions there, do go through it, do have an answer, but they shouldn't be your primary focus. Your focus instead should be the repeat questions with less than a 40% pass rate. And from that, we can see that the exam, that if you do that, you should be able to cover more than a third of the questions that are there. Now, again, as I said, with the difficulty with this exam is that you have to review the learning objectives as potential new short answer questions. That's where they're going to get it from. That's been very consistent from the last sitting, and again, consistent has occurred again with this sitting as well. And I think there's no point in reviewing ICU papers. So take that out. I'm going to take that out in terms of my recommendation with regards to looking at new questions. I think don't bother about ICU papers. The ones that you want to look at now are you want to replace the ICU papers with exams that are over 10 years. And then again, really sort of focus on questions that have a less than 40% pass rate. And hopefully with that, that gives you some key ideas and some structure in terms of how to approach the August exam and beyond.